Good morning, Dr. Palavian. How are you?
Good morning. I'm doing well. I'm delighted to be on this program.
Thank you. Thank you. I am Dr. Jane Mahakian, and I'm president and founder of Alzheimer's Care Armenia. I'm also a gerontologist and licensed clinician in Southern California. And I'm very happy to present today with Dr. Charles Palavian this very informative webinar, which you will be we're going to be having some question and answers too, so we can perhaps discuss that a little bit later. But I want to say that I'm very happy to collaborate with you. We're both members of the Armenian American Mental Health Association. And I want to welcome you and take it away.
Thank you. Thank you, Dr. Mahakian. It's an honor to be on this program. And I'm one of the founding fathers of the Armenian American Mental Health Association, AMHA. And we're located in Southern California. And our organization was founded in 2007. So today, a little bit about me. I graduated from University of Oslo in Norway in 1992 with a doctorate degree in psychology. In 1997, I became, I was granted the status of specialist in clinical neuropsychology by the Norwegian Psychological Association. And I have a second degree, a doctorate degree in psychology from California Graduate Institute. So I have written 2 dissertations. One is allocation of attentional resources in patients with Parkinson's disease. The second one is organic amnesia following herpes simplex encephalitis. So today, we will talk about perseverations in Alzheimer's disease. And so for that, I will share the screen, and it's a PowerPoint presentation. Just a second, and here it is. Let's start. So, and I will push this up. So this is our opening. And this is the title, Perseveration in Patients with Alzheimer's Disease. So what is a perseveration? Perseveration is derived from the word perseverance, which means persistence or endurance or continuation. And it's often mistaken with obsessive compulsive disorder. And because the nature of repetition in OCD and in Alzheimer's disease, they are 2 different things. So perseveration refers to the inappropriate continuation or repetition of a response or activity. It could be emotional manifestation, or it could be gestures. This is associated with a variety of neurological diseases, and when manifested, is thought to be pathognomic or brain damage. So when you see perseveration, it means there must be somewhat a brain compromise. So we are continuing to define what is perseveration. Perseveration is the persistent repetition of a word, phrase, or gesture despite the stopping of the stimulus that led to the word, phrase, or gesture. So we can think of it as a stimulus that triggers repetition in the patient, and that repetition is inappropriate for the context or for the situation. Excuse me. Perseveration is a common symptom of Alzheimer's disease, often beginning in early stages of the disease that progresses rapidly. How are perseverative responses manifested? They can be may be encountered in form of motor acts, like in actions, or in verbal responses, or in gestures. So it can take many forms, and we will address each one of them. And by the end of the demonstrations, the viewer will have a grasp of what perseverative responses are. So a verbal perseverative response may be demonstrated on verbal fluency tests, which may be demonstrated later in this presentation. Perseverative responses may be the cardinal signs of a frontal lobe disorder. So these phenomena have been also observed with humans who have endured a frontal lobe damage. The frontal lobe processes the most advanced operations, commonly known as executive functions. The damage to the frontal lobes may manifest a group of symptoms such as poor decision-making, disturbance in abstraction, problem solving, perseverations, and failure to maintain a set. So what is disturbance in abstraction? So if I ask you, what is the similarity between an apple and banana? We expect not to say they both have skins or they taste sweet, but we expect you to say they are both fruits. If I ask what is the similarity between a piano and a guitar, we expect you to say musical instruments. So this is a healthy abstraction. When you have a person with frontal lobe disorder will be unable to abstract what is the conceptual denominator for two objects or two concepts. For example, apple and banana. Fruit is the common denominator or the conceptual common denominator. So let's move on. An individual with Alzheimer's disease is asked to produce. So now I will demonstrate verbal perseveration. Let's say we have a patient with Alzheimer's disease, and we ask the person to say as many animal names as possible within 60 seconds. So say as many animal names within 60 seconds, the stopwatch will be ticking. So the patient may start say cow, lion, dog, a cat, etc. After 60 seconds, we say, thank you very much. Now I would like you to say as many plants names within 60 seconds. And the person with Alzheimer's will continue to say animal names, such as dog, cat, frog, etc. So as you may understand, the person will persevere in mentioning names from the first category, which was animal names. So he or she will not be able to switch to plant names or fruit names or what have you. So this demonstrates verbal perseverations. Now there are conceptual perseverations. I will move this a little bit down. So let's imagine a person with frontal lobe disorder or Alzheimer's disease. We will say, look at these cards on top. These will stay the same. We have very many different objects here with many different properties or traits or attributes. Your job is to place this card here, 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 or here. If it's correct, I will tell you it is correct. If it's wrong, I will tell you it's wrong. If I say it's correct, continue with the same concept. And if I say it's wrong, abandon that concept and start doing, adopting another concept. So this will be more clear when I switch this to the next card. So let's say we have this cards and you are asked to put this object here, 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 here. let's say, I will try to do this. Okay. Here we go. So if, well, it didn't work, I apologize for that. Let's see. Okay. So if we say, if let's say Dr. Mahakian is the tester, the examiner, and I'm the patient, and she says, place this here, here, or here, or here. If I place it under here, she will say it's wrong. A healthy mind will think, okay, it's not the shape of the objects, then let me try another principle or another concept. And then I will put it here, and Dr. Mahakian will say, yes, correct. And from that, I will abstract that I will think the inference that I will make, okay, then it's color. Let's try this one. So now I'm the patient and Dr. Mahakian is the examiner. She will say, where would you place this? I will think, okay, I will place it under here because this goes with the color. Dr. Mahakian will say it's wrong. And then I will place it, I'm sorry, here we go. I will place it under here. And Dr. Mahakian will say, yes, that is correct. Why is it correct? Now it could be because the same shape or the number. So the answer, it could be shape or number. So I don't know yet, but Dr. Mahakian said it's correct. Let's move on. Now she asks me, place this here, 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 or here. And I will continue to put it here. She will say it's wrong. Because I thought it was either shape or color and it matches here. But she said it's wrong. And then now I know that it should be placed under here because it's number 1, 2, 3, 1, 2, 3. So this is a conceptual way of triggering or teasing out perseverations. I will demonstrate another yet type of perseverative responses. It's called graphomotor perseveration. So let's say Dr. Mahakian is again the examiner and I'm the patient. She says, can you draw this? So she demonstrates this. She says, can you copy me? So if I have perseveration, I will do this. I will not stop until the end of the page. So this is another example of graphomotor, or it's an act, but it's still a perseveration. Now I will demonstrate alphanumeric perseveration, and that will be the last demonstration. So the instructions that I received from Dr. Mahakian on this, she says, can you connect 1 to A to 2, 2 to B, to 3 to C, to 4 to D with the numbers that correspond. For example, in that case, I will do, for example, if I'm a healthy patient, a healthy person, I will do 1 to A to 2, 2 to B, to 3 to C, C to 4, 4 to E to 5, and then D. So as you may see, the alphabet and the numbers are progressing coherently, or they are, so A comes before B, B before C, D, E, and 1, 2, 3, 4, 5. So now let's see how an Alzheimer's patient will behave. Okay. So if I'm an Alzheimer's patient and Dr. Mahakian says, can you connect 1 to A to 2, 2 to B to 3, 3 to C, etc., and to see if my executive functions are working well. So if I'm Alzheimer's patient, I will go like this. Oops, okay. And Dr. Mahakian says, you are not including numbers. I go, okay, so let's, Okay. So, all right. Let's do this. And Dr. Mahakian will say, will you try? Will you want to try again? 1 to A to 2, 2 to B. And this time I will do, okay, she said numbers first. 1, 2, 3, 4, 5. I will ignore the others. So this is another example of Alzheimer's perseverations in Alzheimer's disease. So let's go back to the presentation, which is almost over. Be patient. So cognitive models, what is perseverative error or responses? So let's imagine we have the vinyl record and the patient finds himself or herself in this groove and is unable to get out of it. So it can be envisioned as if this is a problem of being stuck in a groove, incapable of getting out of it. Michael Posner is very famous and very accomplished, well-published neuropsychologist or neuroscientist. He advanced this theory, engage, disengage, model of perseveration. So in the healthy brain, every human being can engage in one concept, in one act, in one gesture, and when we are done, we disengage. So, but in patients with Alzheimer's and with frontal lobe disorder, this disengagement is very difficult to implement. For that reason, the person oftentimes stays engaged in one and feels he or she are stuck in that engagement. So where does this happen? Oftentimes, the frontal lobes that are the substrate of executive functions cooperate very closely with the parietal lobe, according to Dr. Posner's proposal. So this will orient to say engage, disengage, and this will be taking care of the context of the situation. So there is a disorder or dysfunction in this area and in this area, and the result will become oftentimes the perseverative error or response. So now I'm done with my presentation, and we will open it to a discussion where let's discuss what we have seen so far.
That is very interesting, your presentation.
Thank you, Dr. Mahakian.
On the cognitive models of perseveration. You're so right. It's really that person's not able to switch ideas.
Yes. So my hope was, so people can ask, why are we seeing this? In what way will this be? It will benefit me as caretaker, and how what would it contribute to? So my answer to that is, if you understand it, that the patient is not doing it on purpose or deliberately, so the patient is actually has a disorder that is manifesting this kind of symptoms. And so what can be done with it? Dr. Mahakian, you have probably seen it in the course of your profession, and in your encounter with caregivers. Do you have any examples to
I certainly do. I certainly do. And I think, you know, a good example is a patient in a nursing home who is crying out, help me, over and over and over again. So our job as healthcare professionals, as well as family members that have a loved one with a dementia, is to figure out what is behind the reason, what is going on that that person is either having a verbal perseveration or a behavioral perseveration? And does that behavior occur as a result of a trigger? So for example, that person that is crying out for help over and over and over again for many, many hours perhaps in the nursing home, maybe he or she is hungry, or maybe he or she is thirsty, but they cannot articulate that due to their brain disease. So you really want to look at, is this happening in the morning? Does it happen later at night where that person may be what we call sundowning, where you're going to have these changes of behaviors that are more neurologically based? Really what to do for that person that is stuck like Dr. Plavin was saying, like a needle in a record. There's a lot of things you can do treatment-wise. Number one is reassuring that person, as well as distraction. So moving that person to be able to, or helping him or her to switch sets through distraction is something that can be very helpful.
Well, actually what you just presented, Dr. Mahakian, is like as if you are inviting the caregiver to become a scientist. So to test hypotheses. And it was an ingenious way of guiding the viewer or the listener. It is very interesting to think, well, we have something we don't understand, a phenomenon, or a set of behaviors we don't understand. So as Dr. Mahakian suggested, have a set of hypotheses and test them out. So ask the question, is this happening in the morning, in the evening, at noon, or is it sundowning phenomenon? And test them out. What I could add humbly is, for example, show them pictures, photos of drink, water, photos of food, or photos of something else, or pain. So we know Alzheimer's disease patients, if the condition has progressed, they may or may not respond correctly, but nevertheless, it's worth to try out hypotheses. And guess what? If the patient is saying, help me, it's merely nothing else than perseveration. By you showing the person a photo of something, or just simply show a glass of water, you will break away. You will disengage them automatically and in a nice way. Does that make sense?
It really makes sense. And I think another good example behaviorally is a gentleman I remember years ago in a memory care community who continued to bang on the table when seated for meals. Anytime he was seated at a table, a dining table, he would begin to take his fist and bang on the table. And the staff could not figure it out. Nobody could figure out why is he doing this? He would not stop. And they finally ended up, I received a call from their administrator who said, please, can you help? I went over there and found out through my interview with him that he actually was a retired judge.
I see.
And so his behavior was very repetitive, but what was he really trying to say? Was that there was too much chaos in this dining room, and he was not able to articulate that. So again, that caregiver, the healthcare professional, the family member, we need to be detectives to figure things out, because every behavior and everything that a person says when they have a memory impairment has meaning. And our job is to figure out, what is that meaning? What are they trying to say?
Excellent. So this was one of my recommendations, which you already introduced. So knowing the patient's history and background, even though they cannot articulate it or verbalize it. So perhaps you as a caregiver, I mean, if you are the spouse, you naturally and automatically would know the patient's background. But if you are an outsider, a nurse, an LVN, or what have you, knowing the patient's background will help you tremendously in breaking away from the perseverative response or the perseverative problem. So for that reason, let's say if we assume the patient is doing something because the patient this time doesn't have pain, doesn't have thirst or hunger, but is bored. Maybe if it's a lady, we show the lady, if we know from the past that she was a virtuoso piano player, we can show her a photo of piano. And if she brightens up, maybe we can play music. It doesn't have to be that we need to be in possession of a piano, but we can play for her a sonata or what have you with piano is in the foreground. Or if she likes crochet, we can offer her. So as we know, there are types of functions that are preserved in Alzheimer's disease, and we need to base our approaches on whatever functions that are preserved and continue to utilize them.
That's a very good point. It's really truly all about focusing on what that person can do, not on what they can't do.
Excellent.
So thinking out of the box and pulling in those different ideas, different projects, different activities that person can do will serve as a way to get them off the perseverative type, verbalizations or behaviors.
It's very true. So with this, I am hoping that we brought yet another piece of information to help you understand why the patient with Alzheimer's disease does what he or she does. And with that your irritation or your aggravation with the behavior, if it's understood, it will be, you will approach it much more in a different light than, not understanding it.
Exactly. Very true. Very true. And people can also reach out to us, right? If they have questions,
Absolutely.
certainly contact us.
Absolutely. And we will exhibit our contact information at the end of this program, and it will be presented to you in form of email or what have you, or websites.
Sure.
Yeah.
Well, thank you very much. It's a joy, as always, collaborating with you, Doctor.
Thank you, Dr. Mahakian, for inviting me and for this opportunity. I hope this was helpful.
Very good. Thank you very much.
My pleasure. Thank you.
Mm-hmm.